Hello everybody, my name is Taylor Green. I'm one of the audiologists here at Audiology Associates. Now we've got quite a tricky one for you today, guys. It's about 12 minutes long, I think, this one. So a slightly longer video for you. Go and grab yourself a cup of tea or coffee. What we've got here, you can see we've got this kind of dead skin material. Now, almost quite wet as well. Very, very similar to how kind of discharge would sometimes look, with that kind of, you can see that kind of white material that was just kind of shining from the camera there. So what I think has happened in this particular case, on top of the wax buildup, which is very, very deep into the ear, I think this patient's actually had an infection at some point, quite possibly within the last sort of couple of months. Now what we're doing here, we've got, I think this is the fine end that we're using here, just to take away these little pieces of like sort of wet, dead skin before we get to that deeper plug. Now you can see that's the kind of newer, fresher skin underneath. That pinky material, you can see that's the ear canal. So that's the fresher skin underneath. So very, very gently. Again, this area that we're working in here is the bony portion of the ear canal, so very, very sensitive. It's a thin layer of skin on bone, which is why it's so sensitive. So we're working on this deeper section here now. Now you can already see it's starting to come away quite nicely, but in little pieces, which I kind of expected with this particular case. So again, working very slowly into the ear canal. The reason you can see me taking away these little bits of skin around where this sort of deeper section is, obviously at this point I wasn't quite sure whether this was going to come out in one big go, whether it was going to come out in little tiny pieces. Those little sort of like almost flaps of dead skin that you can see on the ear canal, and if you follow the page and you know you're one of the family, you will hear us mention clarinetting quite often. Now clarinetting, if you're unsure or don't know what that is, clarinetting is where there's a piece of skin or wax that is still holding on. As we try to suction it, it vibrates very, very rapidly in the suction tube and creates a horrible like whistling noise, hence the term clarinetting. So we're very, very gently kind of taking these pieces out here, right up against the eardrum. Now, this particular patient was experiencing some difficulties hearing, and completely understandable. It was, even though there's not much there, it's right over the front of the eardrum, so that's actually stopping the eardrum from functioning as it should. So again, very, very slowly. You can see how it's just coming away in tiny, tiny little spots here. Going to say this right at the start of the video, guys. If you do like these videos, obviously don't forget to like, subscribe, and you know to heart the page. We do really appreciate it. Now, what I actually have done for this particular patient is I've referred them back to their GP, as I'm a bit unsure at the moment whether the infection is still present. So I'm getting the GP to investigate this particular case. Get my words out. Sorry, particular patient's case. So in a lot of cases, especially this particular type of sort of infection, if we get a lot of inflammation, a lot of swelling, a lot of GPs in the UK will tend to issue an antibiotic spray for the ear. And the reason you can see us trying to take away as much as we possibly can, even though you can pretty much see the eardrum, is that that antibiotic spray will work better and it'll work quicker as well. We do see it quite often where the antibiotic spray is issued with the ears completely full of that material, which is never really going to work fully. I'm no doctor myself, but I don't think that would work fully. But yeah, with these little tiny pieces against the eardrum now, as I said, we're just very, very finely just trying to take as much of that away. What we will do with this patient as well, once they have been issued a treatment, we generally tend to recommend seeing them again shortly after finishing the antibiotic treatment. The reason being is what the antibiotic spray tends to do is dry things out. So you tend to get this very, very dry sort of layer that also needs to be removed. So we'll see this patient again shortly after. Croaking up again, guys, sorry. So we're almost done with this side. Just trying to get as much as I possibly can here. Now, this patient is actually hearing so much better already. So they've mentioned to me, following that removal of the wetter materials, that they can hear better. So it looks like we're just trying to take away these last little bits that seem to be stuck on the roof of the ear canal. Again, quite tricky to get to. In our clinics here, I know some clinicians will tend to lie their patients on a like a reclining chair, but we get our patients sat up straight. So sometimes these little sections of wax can be quite tricky to get to sometimes. So we're still sticking with the fine. There we go. You can see that just come away quite nice. I'm kind of glad that came away quite nicely then. Here we go. Just gently peeling away some of this dead skin. Little piece on the side there we can see. There we go. Try to get that suction grip to hold on. There we go. Very gently sort of pulling forwards now. There we go. Great. Understandably, eardrum looking very aggravated at the moment. There's a lot of irritation still there, which is why we have referred this patient back to the doctor, back to the general practitioner. This last little bit was, I can remember being quite tricky to get to, because as well as it being in a very sensitive area, it was just slightly around the corner, and we did struggle to get there. But we've got a completely different story actually on this side. A much drier plug of wax here, but this is where you'll kind of see what I mentioned earlier about there being some wetness around where this wax is sitting. You should see, I believe, on this side, as we start to loosen this off the ear canal, you'll see that underneath it's actually quite wet. So the reason you can see me moving to the side here is I'm trying to loosen this and peel this off the ear canal. And then once we give it a little bit of a wiggle, then that should technically loosen this whole piece of wax away. So ideally, getting it all out in one go. I think we got a manual tool in on this one. Yeah, Rosen insert is in on this one. Because of this dry wax, what we're going to try and do now, very, very gently, try and nip over the top in these little gaps and almost kind of try and roll this forward. So I'm creating a gap here, which is why you can see me pulling down on this little section. But a lot of people are probably saying, oh, why didn't you just get in there and just pull it out? I wish I could. It's not that easy. The angles that we sometimes have to work with can make it quite tricky. With us holding the endoscope in one hand and obviously the manual tools in the other. It's quite tricky to maneuver in some cases. I've actually popped a bit of olive oil in here now. You can see this is where that kind of sheen has come from around the edges. The reason I've popped this in is to help with, I'm trying to get my words out, the oil, as we lift this wax, the oil will just kind of slip underneath, and it usually just helps us to slide this out better. And I found that this has worked quite a lot in a lot of cases with dry wax. So a little bit of a wiggle now. Try not to talk too much, guys. Try not to bore you. Right, we're getting some movement. We're getting some movement here now. Again, I'm just trying to hold that suction grip. A little bit of a wiggle. Here we go. It's coming loose. I think there's still going to be more there that broke off. Yep. I'm like as engrossed as you are at the moment, guys. Like, again, all these videos I've done over the last couple of days have been recorded several weeks ago. I've been stockpiling them for you. So here we go, little bit of a wiggle again, and I'm kind of hoping it's going to turn. So you can see we've got this it's almost kind of a slight narrowness to the ear canal. Now everyone's ear canal to a certain degree will be in the shape of a letter S. I need to talk a bit slower as well, my goodness. Here we go, bit of a wiggle. You can see this is starting to come around that corner here now. So you can see underneath how smooth this is around this wax, and this is where it's been firmly attached to the ear canal. And that's a little bit of dead skin as well. You can see that grey material there. That's where we've sheared this kind of dead skin away, and that's what was holding this plug of wax in place. So we're going to take a look behind now. Actually, surprisingly, not looking as bad as the other side, as in not as much over the front of the eardrum, but it's still got a little bit of this dead skin that we're removing now. So we've got the fine end back on here. You can see it's really being quite resistant. With this dead skin, it's always going to be still attached in certain places. So this is why we have to be very, very careful. What I'm trying to do as I move side to side, what we should find is that it will shear away from where it's attached to the ear canal. Now this is obviously going down into the recess as well, so we're not going to be able to see where this kind of shears away. I could have popped a little bit more oil in here to try and help with taking this last bit of skin away, but I obviously like making things really difficult for myself. God, you can see, right, I think we've got a bit of movement here now. I'm trying to hold that suction grip on the skin. You can see it's starting to tear away. There we go. Last little bit we'll try and get away. Eardrum actually looking okay on this side. Doesn't seem to be looking as aggravated as the other side. So that was before, and this is the after shot. So yeah, still going to get this investigated with the GP. So like yesterday, guys, we've got about an inch, 2.5 centimeters again. Seems to be a pretty popular number. Well, yeah, guys, don't forget to like and subscribe and share the video. I completely forgot to do it in the middle of this one again. And I shall see you, I believe, tomorrow. You shall be seeing myself and Rhys. So we will see you on tomorrow's video. Thanks, guys.